larynx and trachea, very narrow membrane. Larynx and trachea membrane. But larynx consists of three large cartilage, such as thyroid, cricoid, and epiglottis. So between the thyroid and cricoid cartilage, there is a membrana cricotireoidea, yes, and we can say that it's a ligamentum conicum. Ligamentum conicum. This ligamentum conicum is very important ligamentum. During the operation on the trachea, when we need tracheotomy to perform tracheotomy, but maybe it's far from the clinic, yes, and we try to go to this clinic with patient, and we can't perform tracheotomy. We may perform operation which we call conicotomy instead of tracheotomy, only for this way, because we can't perform tracheotomy or conicotomy. When we put our patient on its back and put plane behind his back, his head and his neck become longer, and that's why this conicum ligament become wider, and we can cut this ligament for some time, because after when we appears in the clinic, we perform tracheotomy, but for this time it's necessary to breathe. That's why we can perform conicotomy. This organ, in its internal part, this organ has two valves, superior valves. It is only cells of mucous cells, yes, and inferior valves. In the inferior valves we can see a muscle, vocal muscle, and this vocal muscle help us to have a voice. Rima, between the interglottic rima, yes. Then in this rima we can see a small populace of mucous, that's secret, mucous secret. When we need to speak low, our voice become feebler, and these mucous pulps appears, opens, and mucous cover our voice, yes, and improve our voice. Это марганьи, желудочки иногда называют, желудочки марганьи. Понятно? So then larynx transit into the trachea. What can we tell about trachea? From 7 vertebrae, the neck part is 7, second thoracic, yes, second thoracic. Trachea is an organ which consists of cartilage, heavy
cartilaginous ring.
Полукруглый, вот. And on its back base we can see elastic part, yes, and this elastic part attached to the esophagus. That's why when the food passes through the esophagus, it may, она может вдавливать, да, эту часть. So trachea in its cervical part, anteriorly, we can see on trachea, we can see thyroid gland, yes, partly thyroid gland. And we can see brachiocephalic vein, especially in childhood, brachiocephalic artery trunk, brachiocephalic trunk, and so it may be times, especially in the childhood. So, and sometimes 30% has added artery, which we call arteria thoracica ima. It is the artery to the thyroid gland. This artery is very narrow but long, and this artery arrives from the aortic arch. That's why the blood pressure in this small artery is very, very much, and that's why it may be bleeding. If we injure it, it may be bleeding. And sometimes we can't stop this bleeding, yes, and it is a bad final. Финал плохой финал. So literally all organs of the neck has this same. It's a common carotid artery and lobes of the thyroid glands. Yes, that's why larynx and trachea, and behind them pharynx and esophagus. Pharynx is the longest organ of the neck because it begins where? On the external base of cranium. Yes, external base of cranium. And pharynx is a muscular organ without anterior wall. Its anterior part open into the nose cavity, and we call it nasopharynx. From the beginning up to the dense palatine. Then oral pharynx, yes, it's open through the mouth, we can see this part. And then cervical part. Cervical part, anteriorly it's a larynx. And larynx become an anterior wall of the pharynx. Yes? Understand me? So pharynx is a low, very low organ. And what can we say? That in the pharynx we can see a lot of lymphoid tissues, yes, which we call the ridge of Valder Piranov, yes. There are two Mindalin.
Paired dogs. Palatine or tube?
Two tube, yes, gland, two tube gland, two, then two palatine, yes, two palatine, one near the radix of tongue, and one pharynx, yes, between the nasa and oropharynx, yes, adenoid. This adenoid. And in childhood, we can see that many child in the school, in the yard, they подхватывают насморк, да, и воспаляются эти миндали. In the childhood we can cut tonsils, господи, tonsils, yes, tonsils. So as for pharynx, arteria